big hi to all our viewers. As you must have just heard about the new buzzword m.o.p system. We are present right now at Talwar Medical Center M139 GK2 and we are present with Dr. Vivin Talwar. Hello Dr. Vivin Talwar.
Hello.
If you can throw some light upon the m.o.p system.
Well, the m.o.p system basically is a balloon which is part of a program designed for people to lose weight. Essentially, we put a half-a-litre balloon into a person's stomach which allows them to lose weight.
Help us understand how does the m.o.p system actually work?
Well, as I said, it's a half-a-litre balloon which goes into the stomach, so it occupies space. As a result, you feel less hungry. I also believe that there's actually a particular part of the stomach you have to put the balloon in. This allows, or does rather not allow, the stomach from expanding.
How is the balloon placed inside the stomach?
It's done through an endoscopic procedure, and this allows basically the balloon being placed under direct vision. It makes it very, very safe. We first put the endoscope in to make sure we're not causing any harm to the patient. We then put the balloon in under direct vision, inflate the balloon, take the endoscopic out, 10-15 minutes maximum.
Dr. Talwar, who can use the m.o.p system?
Anyone who's overweight who wants to reduce weight. Of course, you should be above 18, you should be safe in terms of medically fit, and we'll assess that. I also think the Indian market has two extra criteria. Firstly, Indians don't like surgery. This is purely a non-surgical procedure, a non-pharmacological procedure. No drugs involved, no surgery involved. Secondly, it's a very, very simple day case procedure. Patients come in and patients go home. We've had patients whose families have not even known that they've had the procedure done. We do recommend, however, that every single patient should tell at least one person, be it a friend or a family member. Well, we've got Mrs. Seema Patania. She was one lady who could use the balloon system. But basically, it's meant for anyone above the age of 18 who needs to lose weight. You have to be medically fit for it, of course, and we'll make sure about that, like we did with Mrs. Patania. But anyone can use it.
Dr. Talwar, you have elaborated upon the significance of the m.o.p system. We are curious to have a live demonstration of the procedure. Will you allow us?
We have one today. You're lucky? You want to see it?
Yes.
Let's go. You want to come through?
Oh, inside.
We've got a chap out here who's come. He's 125 kilograms. He's having the big insertion today. Fingers crossed. When you stand out here, you'll be out of the way. Okay, done. Well done.
How long is the m.o.p system balloon used?
Well, he'll come back here in 6 months, and we are very, very clear about that. We advocate no longer than 6 months. The balloon is designed to last in the stomach acid for 6 months. Beyond that, you're looking for problems.
And what if the balloon deflates spontaneously?
Well, touch wood, it's never ever happened with us, and I don't think it's ever happened in India. There have been case reports about it, and because of that, we put a dye into the balloon. It gives a warning to the patient. They come back here and we take it out same day.
How will the m.o.p system balloon be removed?
The same way as it's put in actually. He'll come back here in 6 months. Through an endoscope, we'll have a look and see what we're doing. We'll puncture the balloon, suck the fluid out, catch the balloon, take it out. 6-7 minutes, very safe, very simple.
How much weight would the patient lose?
$1 million question. I don't know. But the bottom line is that most people are losing between 15 to 25 kilograms. If you're lucky, 42. If you're unlucky, 7-8. But it's a program. You have to remember that. The patient has to play a part as well. The balloon will assist you. It's not a miracle. It'll assist you give up weight.
Now with the b.o.p system in operation, what are the unpleasant effects will the patient have?
Well, the pleasant effect will be weight loss. Unpleasant, 4 things can happen. Number 1, nothing can happen. Number 2, nausea. Number 3, vomiting. Number 4, spasm. It would depend on how he is. Majority, we see about 60% of people have pretty much no symptoms. They're comfortable. About 20-30% of people will have some sort of symptoms requiring tablets. Only about 10% of people would require to come back in or stay in for 24 hours. Majority of people within 72 hours are back to normal.
Now how long will it take to recover from the procedure?
Well, I personally call this a walk-in and walk-out procedure. He's walked in today, he'll have the balloon put in, and 2 hours later he walks out. End of the story.
How important is follow-up visits for the program to be successful?
Very important. Again, I said this to you earlier, this is a program. It's not about a balloon. It's a program comprising input by a gastroenterologist, by a psychologist or a motivator, by a physician and yourself. You have to come here on average maybe about 15 visits in 6 months.
So to sum up, how would you define the b.o.p system?
Fantastic.
We have with us Mr. Pratik Mathur, Chief Coordinator m.o.p program. Mr. Mathur, tell us about the m.o.p program and how does it work?
See, m.o.p is like a completely medical-based obesity treatment program in which we have a full team of doctors who will be guiding you towards the effective weight loss as well as the maintenance of the weight even after the removal of the products like bib and the lap pad. The team consists of a dietitian, physician, physiotherapist, psychologist and a gastroenterologist who will be guiding you in every aspect.
What motivated you to bring m.o.p program to India?
Initially we were just targeting the doctors and were just promoting the products, but that way it didn't help into the average weight loss. So we considered this kind of a program which is a comprehensive program consisting of a team of doctors, as I said, which have actually increased the average weight loss from about 5 to 10 kgs to about 15 to 25 kgs, which is drastic achievement.
When of course anyone talks about weight loss program, what are the kinds of apprehensions that people come to you with and how do you answer all the queries?
There are definitely myths in the mind of the people that yes, for the overweight or obesity, they don't go to the hospitals. But just to overcome that, yes, as I said, obesity has been termed as a disease, so they have to come to a doctor. We've been, noticing and we've been we are counseling the patients who are actually, having full weight loss, and since, they are trying all the other weight loss techniques as well. But it is just a yo-yo effect. Once they stop that program, it is just a yo-yo effect and they get back to that original weight or even more.
To talk further, how do you think the m.o.p program has been successful so far, and if you could narrate some success stories?
As I said, during the m.o.p program, the results have been pretty drastic. We have actually increased from an average weight loss of 5 to 15 kgs to about 15 to 25 kgs, which is quite dramatic. And yes, the results have been pretty drastic, as we've got like patients who have actually lost about 65 odd kgs as well during the 6 months time, and we've got patients who have got about 8 to 10 kgs as well. But yes, results have been pretty drastic and the patients are very much convinced about the procedure.
If you can tell us, where all do you have m.o.p centers in India?
We have a center basically like about 2 in Delhi. We've got in Gurgaon as well. We are having in Amritsar, Tirupati, Chandigarh, Bombay, Bangalore. So it's been like a spread of m.o.p centers during the recent time, and we are shortly opening up in various centers across the country as well.
तो इस समय हमारे साथ हैं m.o.p प्रोग्राम का एक करिश्मा, सीमा पठानिया जी. How excited you are after the weight loss?
My life simply changed after my m.o.p system, and I have been receiving so many compliments that everybody is telling me what has happened to you.
What has been the reaction of Mr. Pathania? Husband साहब क्या कहते हैं?
My husband, he is very excited about it. He just tells me, my God, this woman is my wife. He cannot believe it.
परिवार और दोस्त कैसे रिएक्ट कर रहे हैं कि सीमा का इतना वेट कम हो गया?
My friends were like very excited when they saw me. They could not believe their eyes, and they said, Seema, what have you done to yourself? How did this miracle happen? क्या किया है तुमने? And family, my kids are so happy. In fact, I've been putting on my daughter's clothes lately.
ओके, अब इस एक्साइटमेंट का जब मौका चल रहा है घर पे, हाउ मच वेट डिड यू लूज? टेल अस दैट. कितना वजन कम किया है?
Me, I think I have lost around 26 kilos.
26 किलोज. आपका पहले वजन क्या था और अब क्या है वजन?
I was around 96 kgs. Now I'm nearly 70.
96 to 70. That is quite a number. Seema ji, tell us, did you witness any behavioral, any emotional changes during the program?
Nothing as such. I have always been a health freak. I was always into some kind of a weight loss program. So nothing drastically changed in my lifestyle. But obviously the results after MOP has been phenomenal.
सीमा जी, right now you just told us that you have always been a health freak. और आजकल अगर आप मार्केट में देखें, काफ़ी सारे weight reducing programs आ चुके हैं. Have you ever tried any weight loss program previously?
Anything and everything under the sun. I have gone through everything. I went to any kind of weight loss programs. I have taken any kind of products, weight loss products, be it herbal, be it allopathic, be it Ayurvedic. But the result with this MOP program has been fantastic.
आपके अनुसार MOP प्रोग्राम बाकी सबसे कैसे बेहतर है?
जो मार्केट में वेट रिड्यूसिंग प्रोग्राम्स है, आई वुड से दैट मे बी द रिजल्ट्स विल बी, दे आर गुड बट नॉट as much as MOP system because they deliver what they guarantee. I mean, if Mr. Pratik Mathur has told me that I'll be losing around 25 kilos, I have, and it's a fact.
सीमा जी, आपका अभी प्रोग्राम कोर्स जारी है या समाप्त होने वाला है?
It is just going to end.
Now, with the course coming to an end, what do you think are the differences or the changes that have taken place inside you?
See, mentally I've become a much more, my confidence level has boosted up a lot. I've become more healthy, more light, more fitter, and I did have some problems with my joints and knees. All that has really diminished like magic, and that's it. And physically you can see me.
तो एक नए लुक के साथ आप एक तंदुरुस्ती के एक नए दौर में आप गए हैं. उसमें है चारों ओर आपके लिए एक तरह की खुशियाँ जिसे बोलते हैं.
बहुत सारी.
सो ऑन दैट नोट, टेल अस समथिंग कि इस पूरे प्रोग्राम के अंतर्गत आपने किसी दवाई का कोई इस्तेमाल करा?
No, there has been no medicine, no दवाई at all.
तो आपका एवरीडे रूटीन कैसा रहता था?
Everyday routine is like a bit of exercise and the diet plan, because with this program we have, like, I have lost a lot of appetite. So with the loss of appetite and the right kind of diet, you get the result.
आपकी तरह भारत में बहुत सारे लोग हैं जो कि वेट लॉस करके नए दौर में जाना चाहते हैं, जो कि एक हेल्दी दौर हो. What will be your message to those several thousand Indians who want to get rid of obesity?
Anyone and everyone who is obese, who is overweight, should join this MOP program for a very healthy kind of a weight loss, and they should come and talk to Mr. Pratik. He will let you know more about it.